Joining us, we have Commander Frank Chua, who's a health facilities engineer with the Division of Health Facilities Engineering at the IHS California area. He's responsible for providing professional design, project management, and construction management services to the tribal and federal health programs in California. Commander Chua is a board-certified environmental engineer and a registered professional engineer in California and Louisiana, and spent 11 years in the private sector before commissioning, and served 4 years in the U.S. Marine Corps. We're going to be co-presenting also with Commander Chris Nessett, who we had a presentation from her earlier today. I'll reintroduce that he's currently a tribal utility consultant for the IHS in the Minot district, and is responsible for providing consultation to meet EPA requirements on drinking water and water requirements.
Thank you, Commander Riley, for the kind introductions there. So as you know, this is a hasty presentation that was put together overnight. So, if there's some errors there, please bear with it. But the intent of this presentation is to follow up with all the discussions about readiness and where we want to be moving forward in the future. So Admiral Deezer had asked, Commander Nessett and I to present on our recent experience, the 2017 deployments to Puerto Rico in support of ESF 8. And the importance of that is they may be future missions similar to this as we partner with U.S. Army Corps. So to give you a perspective or an example of some of the missions they may come out as we partner with Army Corps. So basically there's two parts. So we'll provide you an example of the response effort and what the expectations are, what you may encounter when you deploy in partnership with Army Corps. And then there's also the recovery effort. So my part's on the response effort. So obviously this is Hurricane Maria. You notice it just engulfed the entire island of Puerto Rico, and basically it wiped out the power infrastructure. And without power, we're dead in the water. Oops. So this whole thing started with a FEMA request for a critical infrastructure assessment team. And that team came with a set of requirements that included officers with experience and background in health facilities engineering, civil engineering, and pharmaceutical and medical device manufacturing. So those three parts to support ESF 8. And the team that was rostered included myself, obviously I'm a health facilities engineer, Commander Nessett, and also an FDA pharmaceutical investigator, Lieutenant Commander Anika Carpenter. So we deployed in October of 2017, I think it was mid-October, to support ESF 8. And ESF 8 had 5 focus areas. I'm not going to read them all, but we supported focus area number 2, which was to assist the Puerto Rico Department of Health with stabilizing their healthcare system. And PRDOH, Puerto Rico Department of Health, had identified 14 hospitals and 16 clinics throughout the entire island to identify the status of their power. Because this is, keep in mind, this is maybe 3 weeks after the hurricane had hit. So, there's these facilities that are coming online, onesie twosies, based on their redundancy plan. So they PRDOH wanted to assess their power stabilization as the primary element to put a pin in terms of the data point. So with that, here are the mission requirements in terms of the primary assessment. So in terms of power stabilization, they were looking at N+1 redundancy, meaning, if they're on grid power, do they have backup generators? So if they have backup generators, and they're not on grid power, do they have a redundant generator? So basically a duty standby. And also if they do operate in terms of grid and generator power, you know, what's the condition of their generators? So, where was I going with this? So, okay. So when you first get on the ground, you know, this is high level stuff, and you know, as engineers, when you come in, you know, you're drinking from the fire hose, essentially. And for those of you that have not deployed with PHS, that's a lot to take in because you're not sure how you fit in and what your role is in terms of executing this mission that you've been asked to do. So there's a little bit of ramp up time, and part of that ramp up time is to try to develop a scope for what you're gonna perform. So there's an interaction between, you know, the critical infrastructure team and the I forget the acronym for the ESF8, the FACO or FACO. Yeah. So the lead of the so basically you scope out that job to how you're going to do this, and on top of that we scope creeped a little bit and came up with some of these other secondary elements to include, you know, follow up on some preliminary damage assessments conducted by PRDOH a few days after the hurricane. And also we added some of the elements that we thought were important to include: water supply, you know, are they getting water service, what their staffing status are, communications capability, meds, med gas, food supplies to keep the facility in operation. So we scope creep and we added that to our task. And that's one of the reasons why, and I'll get into the reason why Emerald Diesel wanted us to present this, because this is kind of the out of the box, I don't want to say out of the box, but this is kind of the stuff that we think about in PHS that Army Corps, they don't really consider. So when we bring this to the table, because when we went out there to execute the mission, it was a joint team with ESF8 and ESF3. So the reason for that is ESF3, they're the guys that make that determination of whether they had the N+1 requirement. They're basically the infrastructure folks to do the in-the-weeds technical assessment. Where we come in, ESF3, basically we set the mission once we establish the scope of work, if you will. We coordinate that with our partners with ESF3, which is the 249th Engineer Battalion. From there, let me back up a little bit. So once we interface with them, they established an operational tempo. So these are the roles and responsibilities set up by these teams. Obviously, we're commissioned officers, and when you team up with a set of enlisted folks, you know, they look at you as a leader, and by definition, as a commissioned corps officer, you are a leader. As an engineer, you are, and especially the PEs, you are a leader in this field. So they look at you for a lot of the leadership, and in terms of planning, that's paramount. Moving forward, where we come into play is when we execute the mission, we're the ambassadors for FEMA. So when we make a site visit, you know, we need to kind of grease the wheels to, you know, not kick the door down and say, hey, we're coming in with all this equipment and all this help. You will take this and you will like it. The way we've been doing this is we're coming in, hey, we're here with a team of specialists. We're here to assist you. What are your needs? By the way, the local government is interested in this information. How can we help you? Help us to help you, kind of thing. So a lot of folks coming from IHS, we do have that capability, we do have those soft skills, and a lot of folks that do project management and program management, those skills are transferable. So in partnering with ESF3, ESF3, they'll do the tempo, operational tempo, meaning, we'll make so many site visits a day, or depending on the distances that we travel. They're going to do all the load calculations, determine how clean, how good the power is, how reliable the power is, and assess the redundancy requirements. Let's see. So in 10 days, we were able, with that team, we were able to assess 14 hospitals and 1 clinic. And that 1 clinic was on the island of Vieques. So, distance-wise, we covered a lot of ground in those 10 days. And of those assessed facilities, 6 needed generators to meet the N+1. So basically, the Army Corps, when they make their assessments, they're the guys that size it and basically design the project to provide this capability. That's a funny picture. That was our last facility there, so I was pretty happy to get it done. But anyways, what was I going with that? Forgive me here. This was hastily put together, so I've kind of drawn a blank with where I wanted to go. But basically, what I'm getting at is, you're working as a team, and you rely on folks to make the best effort with their experience and their capabilities. Another accomplishment was that we were able to update the PRDOH post-hurricane facility assessment, meaning a lot of the facilities a couple of days after the hurricane was in bad shape. They were out of service, no power on the island, all the windows were blown out. 3 weeks down the road, they were able to do some repairs to the damages, and were able to get back online, maybe not 100%, but a lot of that information, due to the lack of communication, never made it back to the central government. So with this updated assessment, they got a better picture of the medical capabilities throughout the island. So that secondary scope creep that we added to our mission really helped out a lot. And I kind of, in a roundabout way, talked about this, but here are some of the lessons learned on our deployment. Number one, you always check your information provided. You want to work smarter, not harder. Especially the coordinates, because a lot of those sites were provided in terms of GPS coordinates and human error. Sometimes those numbers get transposed, and there were a couple of sites that didn't make sense. So anyways, always double check your information. And the beauty of it, when you team up when you have a team, there's always that opportunity to double check stuff, even to validate your plan. The second thing is, stay in your lane. The previous slide, I identified the roles and responsibilities. So basically, stay in your lane, but don't be afraid to provide professional and technical support, if needed. Because a lot of times you're under stress, you're short on time, you don't really want to make a bad call. So the gist of this is, stay in your lane, but provide your teammates with support if they need. Improve private sector resource collaboration and coordination. This is a higher level stuff. And the reason for this is, for example, at one of the sites that we assessed, we were on the ground changing out generators while Tesla was on the ground looking at putting in solar and battery backup. So there was a duplication of effort, and it would have been good to figure out who was taking the lead on that site. But from a team level, that's really not our call, but in terms of higher up, that would be a good feedback to get back to leadership. of ESF 8. And finally, don't be afraid to fail. When you get called and assigned to a team, you know, I get asked a lot of questions, especially with my replacement. Well, I don't know anything about generators. I don't know anything about, you know, leading troops and this sort of thing, you know. And as engineers, that's your job. You're a problem solver. You're a leader of your profession, and you know, you're a commissioned corps officer, sure, you're a leader. So be confident, rely on your experience, and don't be ashamed or what's the right word here? Don't reject help, is what I'm saying, is like be open to help, assistance. Don't be afraid to ask for help as well. So that concludes my presentation on the response side. Are there any questions?
Just got one. When you were assessing generators and stuff, were you also looking at getting fuel or solar panels or whatever? Was that all part of the thing for a generator?
So on the generator side, yes. So I didn't really kind of get into weeds, but during the, right when we first get on site, you know, we would meet with the facility manager or the CEO or an administrator, and we would go through a list of questions, and that would be one of the questions. You know, if you're on generator power, what's your fuel consumption like? What's your supply logistics? If they don't have any, that's the Army Corps guys will start logging all that information down, because they're the guys that provide the fuel, the generator, the bells and whistles to make everything run. So, yes, sir.
So I got two questions. Is there anything that you wish you would have brought with you? And is there any training that you would have benefited from prior to those?
In terms of gear, I would say there's really no specialized gear that you need, especially for this type of mission. You just need a pen, paper, and a cell phone. Bring two. AT&T and Verizon. The reason I say that because my IHS phone is a Verizon and my personal phone is AT&T, and at that time, getting information was critical. The minute we get our assessment done, as we're leaving the site, we're punching up the report, and then Chris would drive to the point where we can get cell service, and that's when the data would transmit back. So in terms of gear, I would say, just your cell phone, if it's not issued to you, and pencil and paper, in this particular case. In terms of training, I think it's, for the civil type mechanical engineers, this mission is well suited for, but let's say a biomed, I know there's quite a few biomeds out there. If you're called, or if you're rostered on a mission like this, obviously you have some general information about, how these things work, right? But, and this discussion here is centered around a partnership with Army Corps. You're going to have a contingent of team members that are competent in terms of getting into the weeds, so to speak. So they're looking for you to open the door, make the connection, network, create some trust with the person or the agency, the entity that's receiving the help, and kind of deliver the message that we're here to provide assistance. What do you need? And this is what we're looking for to help you over the short term. So the soft skills part. I'm trying to think if there's anything else, but in terms of training, it's hit or miss. It depends on the mission. I'm not an electrical engineer, so you just kind of figure it out as you go along. But like again, you rely on the subject matter experts on your team. Any other questions? All right, thanks.